In progress. Right. Thank you, everybody, for joining us tonight for this webinar on nutrition for injury. My name is Matthew Wilson, and I am the Head of Sport and Exercise Medicine here at the Institute of Sport, Exercise and Health. And I thought this was a really timely webinar. We do a lot of orthopedics, we do a lot of sports medicine, and one area that's consistently neglected, in my opinion, is the role that nutrition has in the injury pathway for athletes undergoing rehabilitation. So it gives me great pleasure tonight to welcome Dr. Richard Allison. He is a performance nutritionist and a clinical dietitian here at the Institute of Sport, Exercise and Health. He has significant experience in this area, and we'll hear a lot about that, particularly within the case examples he'll be using from the questions that the audience have provided. So thank you very much for those questions. So Richard has a master's from Loughborough. He has a PhD in sports nutrition from Liverpool John Moores University. He worked at Aspetar as a senior sports dietitian for a number of years and was poached then by Arsene Wenger to be the nutritionist at Arsenal. He's a keen athlete. He's one of those really annoying individuals who rings me up and I've just run a sub 3-hour marathon off no training. Is that any good? So he's one of those individuals. So forgive me, I will stop talking now and hand over the floor to Richard. Thank you kindly.
Thank you, Matt. Thank you. That's one of the nicest introductions I think I've ever had. Yeah, it's a pleasure to be here this evening, and thank you for everyone who's joined us. I'm going to give sort of an overview that it's going to be obviously underpinned by science. There's going to be a lot of practical application in here and bits of experience from here and there. So without further ado, I'll start. So what I'm going to cover in this evening session is the physiological implications of long-term injury, the nutritional consequences and recommendations that we then apply. I will then take you through a case study of a professional footballer I worked with an ACL injury, and then some take-home comments, and answer plenty of time to answer any questions that have come through previously or during the session itself.
Richard, apologies, my fault. Just for the audience members, if you do have a question, there's a chat button on the right-hand side. I will be monitoring that chat function. I can help facilitate Q&A at the end.
Cool. Excellent. Thanks, man. Yeah, and I'll keep it sort of light, so just I'll ask any questions and we'll go from there. So long-term injuries, unfortunately, are unavoidable. They occur in elite athletes as well as recreational exercisers. They're often non-contact injuries, and sometimes we just don't know why they happen, but they do. But they often lead to immobilization of the injured limb and a prolonged decrease in activity. And this results in loss of muscle mass, strength, and function. And this is a very important part, and obviously in maintaining and returning to play and performance, is to try and get the muscle mass, the strength, and the function back. So this I suppose fairly busy schematic here shows what happens when the metabolic and functional consequences of exercise-induced injury. You basically have a decrease in basal synthesis of both muscle and tendon proteins, as well as a decreased stimulation from amino acids, and this leads to a quick and dramatic decrease in the things that we want, so muscle size, muscle strength, as well as tendon strength, structure and function. So it's disastrous, basically, from a physiological point, to have a long-term injury. And the surgery could also be considered, where appropriate, could also be considered a second injury. So these are things from a nutritional side of things that we need to try and not prevent, not do that, but try and improve as best as we can. So that's the consequence of the injury in terms of the physiology. But what happens then if you have this injury and you have inadequate nutrition? Well, inappropriate nutritional intake will impede recovery from that injury. In particular, inadequate protein and energy malnutrition will exacerbate that inflammatory response. The inadequate nutritional status leads to a decrease in muscle protein synthesis, and all this combined impedes healing and recovery. So I think I've sold it there. Nutrition is important, and nutrition interventions should focus both on attenuating those muscle losses, but also reducing any inflammation. So the immobilization is one of the key areas here, and it increases negative muscle protein balance, and this is mediated by two things. So not only is the actual muscle protein synthesis decreased at a basal level, but actually the muscle protein synthesis stimuli to nutritional intake is also decreased. So you've got a perfect storm here of reducing or potential to lose muscle mass. And these detrimental aspects include downregulation of mitochondrial proteins, metabolic flexibility, by which I mean the ability to respond and adapt to changes in metabolic demand and also in muscle strength, things we really want in our athletes. And this immobility decreases the ability of the myofunctional proteins to respond to amino acids and leucine. So basically, the athlete's not having the loading, and the muscle is potentially going to there's going to be muscle mass losses. But what we do from a nutrition side? Well, there are many nutrients and nutritional strategies that have been proposed to improve recovery from exercise-induced injuries, from immobilization or reduced activity. There's rationale for a number of these nutrients or nutritional strategies, but the evidence currently is limited. And what I will focus on is where the strongest evidence is at the moment, which is on energy balance and protein and amino acid intake. So I'll start with energy balance. So appropriate energy intake during immobilization is critical for optimal recovery and return to training. Energy expenditure will almost certainly decrease from function due to reduced training and reduced activity. And the immobilization of the limb involved in the ambulation may increase this decline further. Nevertheless, the decrease in energy expenditure may not be as great as expected. And this is something we often, as nutritionists, fall down on. And we need to be careful and considerate of energy intake, how much is required before making any recommendation to athletes. And I'll explain why. So we're looking at exercise energy expenditure, and there are several relatively subtle and often underappreciated factors that influence energy expenditure, and thus we need to determine this energy intake during this immobilization. Injury itself does increase energy expenditure, and the magnitude of this varies. This can be from 15 to 50%, but of course this is dependent on the type of the injury, the duration of the injury, and the severity of the injury. So it's quite, obviously it's a broad area there. Furthermore, with injuries that result in crutch use, the ambulation using crutches, the energy expenditure can actually be 2 to 3 times greater than walking. So the total energy expenditure during injury may not decrease as much as anticipated, and this is something that we need to take into account. Now, maintaining this energy balance is crucial. We need to make sure that the energy intake isn't restricted too much, as this will decrease rates of muscle protein synthesis, again exacerbating that muscle loss and slowing wound healing. However, if we overfeed our athletes or injured person, this can also result in excess fat gain, which is obviously undesirable, and then more work is needed to be done once they return to training, return to play. And the way that typically, from a sports nutrition standpoint, that we manipulate that energy intake is through carbohydrate periodization. So generally, both during and after injury, carbohydrate is periodized. Protein and fat intake would be more stable. But in terms of carbohydrate periodization, this is sort of what the ideal world would look like. You've got the stages of injury up there. You've got the acute injury phase, moving through the stages of rehab, return to training, return to play, and the load increases linearly throughout those stages. And therefore, in that ideal world, the amount of carbohydrate that you would feed that player or that athlete or that recreational athlete would be linear as well. However, we all know that that's not how it works in the real world, and people get re-injured, they lose motivation, they stop doing their training or their rehab, so on and so forth. And therefore, the carbohydrate should reflect that energy expenditure, as I mentioned on the previous slide, to stop the excess weight gain. But probably the main macronutrient that we look at in terms of injury rehabilitation from nutrition side is protein. And it's quite clearly the macronutrient that's most associated with support for these long-term injuries. And inadequate protein will impair wound healing and exacerbate that muscle loss. Given that muscle loss results from decreased synthesis of myofibrillary proteins, and the healing process is heavily reliant on synthesis of collagen and proteins, it's no surprise that protein is an obvious thing that we need to manage with our athletes. But what do we need to consider? Because we haven't really ascertained the optimal amount of protein for any given situation. So we need to look at the absolute protein intake, so the net protein that a player is having, or an athlete or a person is having, and that is very useful to get that information of what they were having prior to the injury as well, because any reduction in total protein may have a detrimental impact on muscle metabolism. We also need to consider that athletes and recreational users may have a higher habitual intake than average person, so that's greater than 1.5 grams of protein per kilogram of body mass, and any sudden decreases in protein intake will result in negative nitrogen balance, and that nitrogen loss will almost certainly come from muscle during those periods of negative energy balance as well. So if, for example, if a person, athlete, etc., has been having 2 grams per kilogram of body weight of protein prior to the injury, they come into the injury phase and they drop their protein intake to 1.5, then potentially we're going to be doing even more damage or losing even more muscle mass than if we maintain that habitual intake of protein. It's also worth noting that muscle protein synthesis is maximized with an ingestion of about 20 to 25 grams of protein, and to maximize it even further, that should be taken every 3 to 4 hours throughout the day. There's evidence also for the essential amino acids, and supplementation of those has been known to be used as a countermeasure for inactivity-induced muscle loss, and therefore ameliorating that muscle mass loss activity, as is the branched chain amino acid leucine. So these things are very useful. So we're looking at that both from a real food point of view, so foods with high contents of essential amino acids and leucine, as well as supplementation. This theoretical rationale for a number, as at the beginning, a number of nutrients. These include creatine, which is no surprise really. It's been shown to decrease muscle atrophy in injured athletes, and given that creatine is used worldwide to increase muscle mass, I said there's no real surprise in the evidence supporting that. And studies have shown that after 10 weeks of following 10 weeks of rehabilitation, creatine actually helped to increase muscle gains. However, it didn't enhance muscle gains over a shorter period of recovery. So what we're looking at here is, are we going to give creatine to an athlete with a short-term injury? That's questionable. During a long-term injury, yes, but we also need to consider that the athlete may just be taking creatine habitually anyway as part of their training nutritional plan. We also need to look at omega-3. There's some evidence for there, or considerable evidence for omega-3s. It has anti-inflammatory properties, and the evidence suggests that it could also help ameliorate that muscle loss. Antioxidants, again, there's a bit of noise around them. Their oxidative damage is known to be, or thought to be, the contributing factor, or one of the contributing factors for muscle loss. And rodent studies have shown that the supplementation does help reduce this muscle loss by reducing the muscle protein breakdown. However, the equivalent doses in humans would be problematic or even potentially toxic. So there's still further work to be done. Having said that, vitamin C status prior to supplementation was correlated with improvements in muscle function. So those athletes that were taking vitamin C or having high vitamin C from their diet prior to injury and supplementation were able to have those greater improvements in muscle function. Another nutrient which has been getting quite a bit of noise and evidence for lately is collagen. Whether this is in a shot form, whether this is put in a gel or a jelly, it's the most abundant protein in the human body, and we're talking about the bioactive collagen proteins here, or peptides, sorry. They're absorbed in the small intestine, and they stimulate the mTOR pathway and believed to accumulate in the articular cartilage. And studies have shown that these collagen peptides can reduce activity-related knee pain and reduce the needs for additional therapy. From a practical point of view, we can make gelatin-enriched, vitamin C-enriched gelatin, which has high abundance of collagen, and these can be another way, or this is another way of getting the collagen into the injured person. a bit of variety over just supplementation alone. In terms of supplementation protocol, I believe there's a question coming, but in terms of the way that we would supplement different injuries, they're there on the screen. So in terms of a bone injury, we'd obviously look at blood markers, but supplementation of calcium and vitamin C together. Protein shake again, in terms of protein, we've discussed that. Vitamin C, avoiding deficiency, creatine. Tendinopathy, we'd look again, protein, omega-3, collagen. Muscle injuries, again, similar. Looking at the vitamin D multivitamin to avoid deficiencies, protein shake, creatine, omega-3, and also an overnight protein or a pre-bed protein as well. So alcohol, it's the festive period, so perhaps alcohol consumption has gone up. I'm not sure, pubs might be closed still. But basically alcohol impairs muscle protein synthesis. So day to day, we'd probably advise for most athletes not to take alcohol on a regular occasion anyway. But in terms of an injured athlete, it's an absolute no, in my opinion, and the evidence supports that. It said it reduces muscle protein synthesis and reduces wound healing, and reduces the inflammatory response. However, obviously, with long-term injuries, it's multifactorial, and there are very much sort of psychological issues that need to be addressed. And if you have somebody who's a professional athlete or someone who lives to run, cycle, whatever their sport is, and they rupture an ACL and they're getting told, you've got a minimum of 6 months out, probably a year before you're back to where you were, it's going to be tempting to indulge and numb the pain with alcohol on a regular occasion, or at least a semi-regular occasion. But as I say, it would impair the muscle protein synthesis, so it shouldn't be taken if possible. Obviously, they're the nutrients that we would advise someone takes or not take in the case of alcohol, but we also need to assess what the person is taking, ideally before, but also during and throughout their rehabilitation. So this can be done either by dietary root cause assessment, a snap and send technique, which is often very popular because it takes minimal effort from the athlete's side. They just literally have to take a photograph of their food. Logging apps is obviously very useful and better for the practitioner end, because we get a little bit more information, but again, you're reliant on the athlete themselves, and there may be errors in what they've done or things that are omitted, etc. Another really important part of the assessment, and probably the key part of the assessment at certain stages, is the body composition, to ascertain how much lean tissue that an athlete has, and I'll go into that in the case study a little bit more. And two main methods of measuring body comp that we use are the DEXA and kinanthropometry or skin folds. The DEXA itself, you can see an example of a machine up there. It's very, very quick, or relatively very quick. It takes about 7 minutes to conduct a scan. The limitations are you really should be scanning the person fasted at the same time of day and with the same hydration status. And the results that you get from DEXA are bone mineral density, fat mass, and lean mass. You can also look regionally at both or all three of those metrics, which can prove very useful when you're dealing with a long-term injured player and you want to look at injured versus non-injured limb for comparison. Kinanthropometry, it takes longer, therefore is less popular in terms of athlete time, and it does have issues when you're looking to determine percentage body fat, because everyone wants to know their body fat. And if you can see at the bottom of the screen there, these are the same results but different equations to ascertain percentage body fat. And as you can see, the first one, that particular person is 17% body fat, and on the second equation there's 7. So there's a lot of variation in there, and that's when using skin folds and kinanthropometry, you try to avoid using the percentage body fat, and use the absolute figures for adipose tissue, muscle, residual mass, bone, and skin. One of the big advantages, I would say, from the data you attain from kinanthropometry is what is the muscle to bone index. And so this is very much an individualized metric where you can ascertain how much lean mass a person can put on relative to their skeleton, self-explanatory. However, that is typically capped at either 5 or 5.1 to 1 as a ratio. So therefore you have that metric and you're able to discuss that with the athlete, the recreational athlete, about how much muscle mass they can put on or how much they should be at during the rehabilitation phase, and then when they return to training, return to play. So, as Matt mentioned in the introduction, I spent some time both at Arsenal. Before that, I was at Aspetar, and in that time, I've worked with over 300 athletes with ACL injuries. So I've had a bit of experience here, and they're an unfortunate injury, but I think that's where a lot of the nutrition can have a big impact with these injuries. Unfortunately, they cause huge layoffs, 7.4 months on average. But as I mentioned on a slide, in particularly football, you're looking about 10 to 12 months before a player is fully back to where they were prior to the injury in terms of match fitness, match sharpness, and all those other variables, not just injury healing. And apparently the rate of injuries hasn't decreased over the last 15 years. And as I said, why the return to play is very high, greater than 90%. It would appear that in European football, only 65% of those with ACL injuries are still at top flight football 3 years after that. So it might not be a career-ending injury for a lot of players, but it could be a career-impacting injury. So the ACL rehabilitation is split into phases: the initial, the immediate, and the advanced. The initial phase, this is where the nutrition can have the biggest impact, and this is typically post-surgery to 8 to 12 weeks. And the objective there is to protect, minimize those lean tissue losses and aid the player's progression and help them get to that stage where they can tolerate higher loads, whether that's in the gym, on the bike, whatever their sport is. So from a nutrition standpoint, the intervention looks at basically 3 areas. We're trying to maximize that muscle protein synthesis. We're trying to balance the inflammation and manage the overall carbohydrate intake. To give you an example of what that looks like in the real world, I'm now going to present a short case study on a professional footballer that I work with from basically prior to their injury and all the way through their rehabilitation process. So a 23-year-old male defender, and the rest of their objective is there, 190 centimeters tall, 82 kilos, and a little bit on the high side for body fat compared to some players, but that was pretty good for that player at the time. The injury occurred during a match. Again, it was a non-contact injury, and up until the point of that injury, the player was training regularly, hadn't had any time off, etc. And it was a left knee ACL internal meniscus tear. And they had reconstructive surgery 6 days after injury. Now, obviously, this is professional football where that's a common occurrence. Maybe for the recreational athlete, having surgery 6 days after injury might not be realistic. In this case, the player generally understood the duration of inactivity, which helps a lot. We explained what to expect in terms of lean tissue losses and those changes in body composition. As I mentioned on a couple of previous slides, in my experience of working with a number of and scanning in terms of DEX or a number of ACL injured athletes, the average lean tissue loss is just under 5 kilos from 2 weeks post surgery. So yeah, that is something that obviously when you explain that to a player, they want to do what they can to try and maintain that muscle mass the best they can. And that's what we did. We discussed those nutritional strategies on how to basically attenuate those lean tissue losses and reduce any excess fat gain. Now, in terms of the way I simplified it for the player, there's sort of 3 things that are very important in terms of training and maintaining muscle mass: sleep, load, and nutrition. Now, load, I think, is obviously off the table during that kind of injury. However, what I didn't, and hands up had made not an error, but I hadn't accounted for how much impact the injury has on sleep, trying to sleep with a brace on, with the pain. And a number of athletes have explained to me that actually sleeping, particularly in that first 2 weeks post-surgery, is very, very difficult and continues to be difficult throughout. So basically, the only thing you can control very well is the nutrition. So what we did was we took dietary recall from this particular player to determine nutritional intake, frequency, macronutrient intake, and this was analyzed through software. And you can see the outcome there, their average daily intake, and that varied due to periodization. Average of 150 grams of protein, which worked out at 1.8 grams per kilogram of weight, and about 1 gram of of fat per kilogram of body weight. In terms of objective data, as mentioned earlier, we used the DEXA scan to estimate body composition. We used the regional areas there to determine or compare injured versus non-injured limb. Now, this was led by the head of physiotherapy in terms of where these point of separations would be. And then we ascertained total body fat, lean mass, etc. And this player was scanned pre-surgically, 2 weeks and 8 weeks post-surgically as well. And what the data showed was that this particular player had sufficient total body lean mass, including that in the injured limb. And that's how close we were. Obviously, we'd scanned them very, very close after injury. And they had, as I said, a good understanding and practice of nutrition. So what we did in terms of nutritional recommendation, and sometimes the simplest is best, we increased his total dietary protein to 2 grams per kilogram of body weight. We ensured he was taking that protein every 3 hours in 20 grams sort of bolus. Supplementation came into effect there. Again, back to the collagen shots, not just because of the apparent benefits of collagen, but they're basically 20 grams of protein in a 60 milliliter shot, so they can be taken at any time. We also tried to balance inflammation with fish oil and turmeric and manage the carbohydrate intake. And at the beginning of the rehabilitation process, that was about 2.5 grams per kilogram of body weight, but we also avoided the micronutrient deficiencies. And here's the table here, a breakdown of what we did in terms of protein, vegetables at every meal, the complex carbohydrates, which meal they were at, the collagen shot, which I've mentioned, which was used twice a day to keep that regular protein intake, creatine, again, taken, omega-3s to reduce the inflammation, turmeric as well, reduce the inflammation, and also a multivitamin, just to try our best to avoid micronutrient deficiencies. And that was a full spectrum multivitamin, including vitamin D. And again, they were advised to avoid any pro-inflammatory foods, high sugar foods, etc., etc. But we're working with that player every single day, touching base with them multiple times a day. So we were able to really use that MDT approach. And so the physio would be reiterating these key messages. So I think we did a really good job in getting this message across. And here's the evidence. So this is percentage body fat on this graph here. You could see this player sat around about 10% prior to surgery. Fortunate enough, we were routinely scanning our players at Arsenal. And so we had this data. As you can see, pre-surgically, source of scan, and 2 weeks surgically did very well to maintain that percentage body fat. We then saw, again, maintained rather well, and then approximately after 8 weeks, we started to see an increase in percentage body fat, which then escalated into way past 14. I think it's about 15% body fat by 29 weeks. And I'll explain why that happened in just a moment. But once we got the player back, we could see that we were able to bring that percentage body fat back down. And of course, this is reflected in the absolute measures of fat mass and the absolute measures of lean mass. Whereas obviously the lean mass is the converse, where it had dropped as expected. We managed to get it back, and then it dropped again. And the reason for this drop was because of the off season, and the player went on holiday, so had no longer had access to the physio, didn't have access to nutrition, didn't have access to all the things they're used to having, and plus they were on holiday, so they were partaking in eating more, drinking more, etc., like most people do when they're on holiday. And then once they came back in the pre-season, we were able to get everything back on track again. And just to have a look at the injured versus non-injured limb, just a reminder, the left leg was the injured limb. So pre-surgically, they were almost identical. Typically, you don't see anyone with perfect 50-50 symmetry in terms of legs via DEXA. As you can see, 2 weeks post-surgery, the right uninjured limb had reduced somewhat, but not as much as compared to the left leg. And we managed again to get that closer to being the same 8 weeks post-surgery. So in terms of an overview of those nutritional recommendations, it's fairly basic and fairly straightforward, but the application is slightly more tricky. So we're looking to increase the total dietary protein to about 2 grams per kilogram body weight. That 20 grams of protein every 3 hours, or adjusted to make that 2 grams a kilogram of body weight. We balance the inflammation with fish oils, turmeric, manage that carbohydrate intake to prevent excess weight gain and avoid micronutrient deficiency, which is often done with a multivitamin. In terms of reflection, the player did well to maintain their lean mass. The MDT, the interdisciplinary approach, was very, very good. That daily contact I felt was really essential for us being so reasonably successful early on. And again, the DEXA was or anthropometry body composition was a useful tool for demonstrating the impact of training. However, the downside was the player then let themselves go during the off season. And if we'd been able to measure energy expenditure throughout the rehab, I think we would have been able to better tailor that nutritional support. Although the evidence isn't absolutely there, would have been interesting to trial HMB, obviously do no harm, and also try and improve that sleep, particularly in the first 2 weeks post-surgery with sleep supplementation such as tryptophan or Cherry Active. So in summary, there's still a lot to be learned about the best nutritional strategies to enhance recovery from exercise-induced injury. We need to be careful evaluation of the individual. So although I've presented sort of generic recommendations, it's very much down to individual support. What does that individual do? Are they a professional athlete? How are they dealing with it? How are they sleeping? All these things that are very, very individualized to them. The focus of the basis should be on food first, getting that base diet right, and then bolstered with nutritional supplementation, particularly to avoid deficiencies and try and keep that energy and protein in check. And micronutrient deficiencies should be avoided. As mentioned, energy balance is critical where we can, and we should be assessing and reassessing the injured person throughout the process, and even post, obviously, once they return to play, and we should consider those higher protein intakes. And there's promising evidence for a number of micronutrients, but we need more data. We need more research to be conducted. And again, caution is warranted before making recommendation to injured athletes. I think you should always refer to a trained professional. So thank you very much.
Thank you, Richard. Maybe just put that last slide back up if possible. Can you go back? Oh, here we go. Right, it's good to help me in my memory, just the questions. Okay, so some great questions coming through, and a couple perhaps we can sort of explore a little bit. The first one is on energy expenditure. Now, myself as an exercise physiologist, having a metabolic cart close to hand, it's all very well me saying bring somebody into the laboratory and we'll give them a basal metabolic rate and then we'll calculate everything along those lines. And in your practical experience as a dietitian and athlete recall, how accurate are food diaries in the implied setting? I suppose it's probably a little bit better when you can control everything that goes in at the club versus the energy expenditure that you're asking athletes to, you're trying to get them to rehab, you're trying to keep them moving, you're trying to keep them not immobile. So how do you overcome those challenges?
So it's got two parts there. Yeah, dietary recall is not great. There's sorry, that slide's gone now. I think that's well established that it's not all our memories are not the best, and we'll miss things. And when you're talking about maybe a few hundred calories here, a few hundred calories there, it may make all the difference. Plus, you have to understand that the player might not buy into it, and therefore give you the wrong information anyway. The old snap and send works well because today with all our smartphones, etc., you've got a time stamp on that as well, and you can ascertain that a player hasn't sent you that information if the first photo is at 8 a.m. and the next photo is at 5. There's a good chance that they've missed lunch and any snacks in between. So it's good, a good way of doing it. So yeah, I'd prefer the old snap and send over dietary recall any day, and genuinely, in my experience, the athlete prefers that as well.
So let me interrupt. So simply, you will have an athlete take a photograph of what's on the plate in front of them, and then you'll do what? Create a historical record of those meals.
Yeah, and I will use dietary software to analyze that. So in part of that, I don't just ask them to take photographs of the food. That's a very simplistic view. I always ask them to give me some kind of reference for size, what side, are they eating off a kid's plate, et cetera, et cetera. There's some technology that's verging technology. I know that Apple have bought an app which apparently is getting close to being able to do that for you, where you take a picture of a plate and it will analyze the food. But I'm hopeful more than anything else on that. But yeah, just the second part of that question is I actually find the energy expenditure is more difficult to measure because athletes, and this is woe is me, professional football world where they don't want to wear an Apple Watch, for example, because it's not, it's below what they would wear. So trying to get them to wear an activity tracker of any kind is difficult. Now, I have had success with that, and I've got players to buy Garmin's or whatever. Sorry, dropping names there, but it's brand, sorry. But yeah, it really does help them also when they go, oh, okay, that was my energy expenditure a day. I've said this before. You really need to consider what a player does outside of the training ground in terms of energy expenditure, where you will have some players that will, roll out of bed, come to the training ground, do as minimal as possible, drive home, and then sit and play Fortnite for 8 hours, and their background energy activity is energy expenditure is very low. Whereas you'll have players that will go and play golf after training, or go and play football, or go and play five-a-side. So again, you need to take that into account. Obviously, we're talking about injury, so that's unlikely, but it's also worth knowing, the mindset of your player and monitoring that background energy activity.
Okay, so then if we just move on then, I mean, we're very fortunate here at the Institute to have a DEXA machine, but not everybody is. So, just to go back to the kinanthropometry, is that a highly skilled assessment, or can people be trained up and get their coefficient of variations down? The value of that versus DEXA, for example. I mean, DEXA is really simple. It's expensive though, however.
Yeah. So being able to use a DEXA, I'm not hopefully not insulting on you. Obviously, using a DEXA is very simple once obviously you've been signed off that you're allowed to use it, because obviously it has a small amount of radiation. But basically, once you know how to get someone to lie on that bed and press the right buttons, that's all you need. And then it's obviously about interpreting the results. The kinanthropometry is a much harder, in my opinion, qualification to get. You have to sit exams. You are assessed on how accurate you are. You would have to go away, do the course, which, there's level 1s, level 2s, level 3s. Once you've passed the course, say on day 3, you then have to take 20 profiles to be that are then submitted, and they're checked. So that there is a high level of assessment to be able to get that, which obviously is difficult, but people want to do it. But I think that
so maybe if I just jump in then. So what about the role of bioelectrical impedance? They don't cost very much, and you just grab a couple of handles and measure the strength of the signal. What about bioelectrical impedance?
There, if used routinely with the identical hydration status, time of day, same dietary intake, they can have a level of reliability, but they don't have the level of accuracy. So your hydration status will massively affect those. So you can, the study's been done, I've studied on myself, where you can take a body composition analysis by bioelectrical impedance, go and drink, say, an electrolyte drink, come back 2 hours later, and it will have changed your body composition significantly. But having said that,
sorry, I set you up on that one because I knew the answer. Apologies. One thing I want to explore here is the protein. We've had a couple of questions on protein, and it's not so much the grams per kilo per body mass. It's how do the athletes tolerate that much protein during the day? I mean, I know you have a very solid food first approach, and the variety of sources for protein that you obviously have. But actually, do you find that the athletes struggle to tolerate that much, or is that actually no, they can tolerate a lot more?
In my experience, they could probably tolerate more. I don't think I've ever had any issues with, or at least not been told any issues of tolerating that amount of protein. The application is probably more difficult in terms of keeping the variety. So food first approach, you can get 40 grams of protein quite easily 3 times a day for your main meals. So in this case of the player I'm talking about, in that case, he's already got 120 grams of protein for his main meals. He's having a pre-bed protein shake that's 20 or 30 grams. He's almost there, and then you bolster on the the 2 collagen shots, and it's simple. It's more about the players that I've worked with where, for example, they've been on vegan diets or they haven't wanted to take supplementation, and that's where it becomes more tricky. So it's actually not the tolerating in terms of the amount of protein, it's trying to actually get it into them in the first place.
Well, I'll talk about vegan in a moment. I want to just come on to that. But just to carry on the protein theme, do you find that some athletes tolerate what forms of protein are tolerated well? Is it fish? Is it red meat? Is it white meat? Is it a combination of all of them? Or are you actually saying you should not have too much red meat, for example?
Typically, we would offer a range of protein animal sources. So it would either be a white meat and a fish, or a fish and a red meat. So not all 3 on the same day. And no, not really in terms of there are players that, for whatever reason, whether it is belief or superstition, won't eat red meat on the day of a match, and so it's all white meat. It's all chicken or turkey, which nutritionally is fine. We've got no with qualms with that at all. So we tend to feed the white meat on the pre-match meals and the evening before a match.
Okay. And then sorry, I know you've spoken about timing lots, but I just want to really clarify that. In your opinion, if you had to pick 2 or 3 windows for an optimal protein time, there's lots of strong evidence for this pre-bed protein shake in terms of, your nadir of your sleep cycle, etc. But is there a crucial time first thing in the morning? Is it after rehab? Is it pre-rehab? Or where would you, if you were strategically to put your grams per kilo?
I mean, Luke Van Loon's, produced so much research, and there's a lot of data on this, and some of his shows that it can maximize protein synthesis 48 hours afterwards. So this, let's call it bro science of this anabolic window, it doesn't exist, or it's not supported by the science. So in terms of actual key slots, it's more about this convenience. So it's upon waking, we know that there's an impact there. So it would probably be almost a classic eating schedule. So breakfast, lunch, dinner, and as you rightly said, that pre-bed protein, because we know there's some benefit to taking pre-bed protein. So if you couldn't have the snacks in the day, it would just go with sort of your classic 3 main meals and then a pre-bed feed. It can be real food. It doesn't have to be supplementation.
Okay. Question here on turmeric.
Yes.
Turmeric ?
Yeah, so there's some evidence. Again, it's not the strongest evidence, but it doesn't do any harm. So that's why it's routinely used. So it's a curcumin, and it has been shown to reduce inflammation. And as I sort of led myself into this, when I'm dealing with, say, a vegan athlete who will not take omega-3s, you need to look for other sources of, or easier supplements to reduce inflammation, and curcumin or turmeric is one of those.
Okay. Another great question here, and it applies to me through my wife who's in the midst of a gynae stroke dietitian issue. What advice would you apply to female athletes with regard to nutrition and their menses cycle, particularly from an injury perspective? I certainly have, my wife popping off next week for an iron infusion because her iron status is so dramatically low.
Well, you've answered them. Most of the basics in terms of the nutritional strategies would be the same, but you would look at it depends how often you're able to analyze blood, and get those ferritin iron results. But an iron supplementation would be warranted. We have had issues with the way that affects the GI tract. So, that you've got to take into account that even though you're giving the athlete or the female athlete the iron supplementation orally, they might not be absorbing it, or they might not be able to tolerate it, and therefore infusion might be the way forward.
So you wouldn't change the diet by the menstrual cycle?
No, not
you would alter the diet based upon the energy expenditure?
Yes, yeah.
Okay. The next question is for the amateur athletes. I mean, obviously, all the information you provided this evening, and we gratefully receive it, is on a very unique population. But this evening, for the weekend warrior, for the old folks like me who got a dodgy shoulder, dodgy hip, dodgy back, what can I take from this? Am I strictly adhering to this? Because I can't do that at work, for example, but I still want to be active at the weekend.
Yeah, so obviously that's a tricky question to answer generically. Obviously, it comes down to the individual, where their priorities lie, etc., etc. As mentioned, the taking of, say, protein every 3 hours is maximizing your ability to increase muscle protein synthesis. You're still going to increase your muscle protein synthesis if your net protein is adequate. So yes, you may just have to eat your 3 meals a day, whilst you're at work, etc., and get your protein that way. If I was really forced to suggest supplementation, I would probably look at again the collagen shots because of convenience. There's a cost aspect to that though, so we need to bear that in mind, and the omega-3 or the curcumin if the person is vegan or doesn't eat animal products. That's where I would go to.
Okay, so just on those collagen shots then, they're getting quite popular now. You see them in the various online sales websites, or you see them in the supplement shops down the street. But when we talk about collagen, there are lots of different forms of collagen. And are you looking at this from an injury perspective, or are you looking at this from a tendon perspective?
So if I'm completely honest, Matt, I look at it from a protein perspective first, because I look at it practically of like, yes, I'm very hopeful that there is research out there. I've cited some of it on the next slide with the references that shows that it reduced knee pain. It may improve.
In fact, do you want to just put those references up, just so if any of the delegates want to jot them down? I know Keith Barr is doing a lot of work in the United States on.
If you can see those, you might have to screenshot them and zoom in. Yeah, so there is great work being done in terms of the research on how those collagen proteins, which collagen proteins are the best and which ones are stimulating mTOR pathways, which ones are improving tendon healing, etc., etc. And as we often talk about, I think you can translate elite sport into elite weekend warriors, and weekend warriors is that you want to be ahead of the research, and giving someone a collagen shot doesn't do any harm in terms of it being collagen. It probably does them a lot of benefit in giving them 20 grams of protein, and it's convenient. And where I would recommend it is when someone wouldn't eat food anyway. It's not to replace food. It is exactly what it says. It's a supplementation. So if you've got a few of those collagen shots in your bag, and it's almost like nutritional insurance, and you're running late or whatever, the real world gets in the way, or you're in your car, what are you going to do? Stop at a service station and pick up a sandwich, or you can bang 20 grams of protein. So there's an element of convenience to that that I think supersedes everything else. Then if you take it to the next level, yes, there's evidence to show that it does improve wound healing and does reduce joint pain. So I just think it's a win-win, and hopefully the research will definitely catch up with it.
Two final questions then, because we wrap up in the next sort of 5 to 10 minutes. The first one is on plant-based foods. I know you've worked with a couple of vegan athletes before who have injured, who've returned to play. How would your recommendations fit with those individuals?
So
sorry, it's a loaded question, I suppose. It's a loaded question. I'm sorry, you probably can't answer it in 5 minutes, but vegan essentially versus vegetarian, because vegetarian, I get the fact that you can find alternative protein sources.
Yeah, so the can be, of course, it can be done, and I'm definitely not anti or pro-vegan or plant-based. Sorry, it's again down to the individual. No, I have worked, as you rightly said, I've worked with athletes who are vegan and who have become injured, etc. And the biggest issue that I've had with that is not necessarily the veganism itself. It's, there are sources of protein, there's adequate sources of protein, but it's actually getting them to eat enough. It's the actual volume of food that they have to consume to make to reach the same grams per kilogram of body weight. And where in one case where the player was quite happy to take vegan supplementation, no problem at all. It hit it, daily, no issues in terms of net protein. But in terms of the athlete that didn't want to take any supplementation, then it was a real battle. And this particular player had a personal chef who was producing all the meals for them, 4 or 5 meals a day, and they still couldn't hit the targets. And we saw this reflected in reduction in lean tissue. And then there was a correlation between that and injury and various other things. And I say correlation very strongly because obviously it wasn't supported. But, from a nutrition side of thing, we really needed to, sit down, almost had an intervention with this particular player to say, look, it can be done, but you really need to focus. And often what we miss in terms of nutrition is, like what I've just discussed now, take this, take that, this time, that time. But that's what's on your plate. It's not just about what the player puts on the plate. It's actually what they consume and actually what they absorb. So in this particular case, the player was getting just about the right amount in terms of food put on their plate on a daily basis, but they weren't consuming enough of it. So they were only eating, say, 75% of it each meal. So over a period of time, you're 25% down on what you should be.
Okay, interesting. A few questions and a few prior to joining this evening is specific names of supplements. Now, I know that Richard, you like to be independent, and I know you haven't put any names of any products up. But what would your recommendations about where people source their product information from? And, are there warning signs for them to look out for about this is a good collagen shot versus that's not a good collagen shot, or this is a reputable protein dealer versus a non?
Yeah, so I could potentially reel off company names here, but I think the easiest and the most politically correct answer would be to use the Informed Sport website, because every single company on there will have sent that particular collagen for testing. There'll be a batch number, etc., etc. So it is what it says on the tin if it's on Informed Sport. So they'll all be reputable companies on Informed Sport.
So for the novice in me, and because I could be completely talking rubbish, do they look at the quality of what it contains versus an anti-doping perspective?
Yes, they do both. So you have both Informed Sport and Informed Choice. They're both LGC Lab accreditations, qualifications, and one is the reason I said Informed Sport first is because Informed Choice is just that kind of kite mark for quality, whereas Informed Sport is both the kite mark for quality and the anti-doping as well.
Okay, and so for the folks on tonight looking for collagen, looking for protein, looking for other supplements, omega-3, pop to the Informed Sport website, and they will have the list of suppliers on there.
Yeah, and you can search by, you could search by collagen, you could search by omega-3, or you could search by your preferred company.
Okay. Now, my final question, because I know you've got to go. You're looking at the clock. I can see you looking at the clock. You have athletes, say you have athletes who are going to go away on holiday, right? Do you believe what they say they are going to do, or do you say, actually, I accept that they're going to have a blowout for 2 weeks, and I deal with the consequences on the other side?
A degree of the latter, but to a degree. It comes down to knowing your player. So certain players, when you get to know them, or certain athletes, when you get to know them, you've got a good idea what they're going to do anyway. And so if you can give them certain things to mitigate, if it's just all is they take some protein powder or something with them and they take that once a day. But there's some psychological benefit for anyone to go on holiday and just get away from it. And I think what I wasn't fully aware of, and a lot of people aren't aware of, is that despite the flashiness and the sort of the trimmings that go with professional football, it is relentless for a season. It is relentless. There are very few days off. You don't get to choose, oh, it's my son's birthday on Saturday, I want to have that. You don't get to choose that. Yes, the players are well compensated with money, but it does strain on their lives. and obviously the intensity of the Premier League has increased dramatically. So there is, you see them come back from the off season different people. You know, it really does give them that sort of psychological break. Now this year's been completely different. I don't think I need to point that out, but generally that's so for a player to go away for 2 weeks. I'm going to give them the list of things to do. The S&C coach is going to give them a list of things to do. Someone else is going to give them a list of things to do. And if they do 10% of it, we're happy.
Great. On that note, we'll leave it. So, Richard, thank you for your time. Thank you for all the delegates that have joined this evening. And thank you very much in the last couple of weeks. We hope we've been able to answer all of them. If we haven't, please email me on the link that you had sent around. There'll be some feedback. Put the question, and we will get back to you with an answer individually. So thank you very much for your time tonight. Have a great evening.
Thank you, man.